Hello everybody, welcome to my channel. In this video, I'm going to go over 5 high-yield MCAT psychology questions that you need to know. A researcher plays a specific tone immediately before delivering a puff of air to a participant's eye, causing the participant to blink. After 20 pairings, the tone alone causes the participant to blink. 2 weeks later, without additional pairings, the researcher plays the tone again, but the participant does not blink. The researchers then deliver a puff of air immediately after the tone, and the participant blinks to the tone alone on the next trial. Which of the following correctly identifies the role of the tone during the first pairing session and the trial immediately after reintroducing the puff of air? So, let's define some terminologies here. First of all, conditioned stimulus. Conditioned stimulus is when you're conditioned or trained to do something. And neutral stimulus is when something is neutral to you. So there is a stimulus, there is a signal, but that is neutral to you. You don't show any reactions. And unconditional stimulus. Unconditioned stimulus is when you naturally react towards something without being conditioned to do so. In the first trial, the participant does not blink because the sound was there, right? So for the first time, the sound was totally neutral. In the second time, the participant does blink after hearing the tone. So that's conditioned stimulus. And you might ask yourself, well, at first, when they delivered the tone, he or she didn't blink, but then when they did it again, the participant blinked. So why? Because they conditioned the participant in the first trial, but there was an extinction of behavior. When the participant came back, they conditioned the behavior again. So that's why it's conditioned stimulus. That's the correct answer. A parent wants to reduce their child's habit of shouting at the dinner table. They try 4 different strategies over several weeks. When child shouts, the parent takes away dessert. When child shouts, the parent tells them to sit quietly in another room for 5 minutes. When the child speaks politely, the parent gives them a sticker towards earning a new toy. When the child shouts, the parent frowns and shakes their head disapprovingly. Which of the following correctly identifies the type of operant conditioning used in strategies 1 and 3 in that order? So we need to define some terminologies here. First of all, negative punishment, you take away something to prevent someone from doing something. Positive reinforcement, you give something to someone so that they keep doing whatever they are doing. Positive punishment is when you do something, you add something new to discourage someone from doing something. For instance, your kid keeps shouting and you yell back at them. That's positive punishment. Positive reinforcement is when you give someone something so that they keep doing whatever they are doing, which I already described. And negative reinforcement, this one is tricky. Negative reinforcement is when something is removed, something undesirable is removed so that you encourage someone to do something. Let's say you're driving your car, you're not wearing your seatbelt, and the car keeps ringing at you, right? But once you wear your seatbelt, the ringing goes away. That's negative reinforcement. When you do the desired action, the sound goes away. Negative reinforcement. Okay, so in the first scenario, the child shouts and the parent takes away the dessert. So that's negative punishment. Something is taken away to prevent some behavior. But in the third scenario, when the child speaks politely, the parent gives them a sticker towards earning a new toy. So that's positive reinforcement. I would go for A, and that's correct. 3. A researcher is training 2 groups of pigeons to pick a button. Group 1, the pigeons receive food after every 3rd button presses. Group 2, the pigeons receive food after an average of 3 button presses, but the exact number changes unpredictably, sometimes 2, sometimes 5. After several weeks, the researchers stop giving food entirely. Which of the following correctly identifies the reinforcement schedule for group 1 and group 2 and predicts which group will continue picking for a longer time after reinforcement stops? So we need to define some terminology here. Fixed ratio. So you give the food after a certain number of presses. So every third press. Variable interval. Variable interval is based on time. So you give the food after 3 minutes, then after 5 minutes, then after 10 minutes. And variable ratio. Variable ratio is when you give the food after random number of presses. First, you give it after 3 presses, then you give the food after 5 presses, and so on and so forth. So, fixed interval makes sense. You give the food after a fixed time. So, 5 minutes, 5 minutes, 5 minutes, 5 minutes. In this case, in situation 1, the pigeons receive food after every third button presses. That's fixed ratio. And group 2, the pigeons receive food after an average of 3 button presses. But the exact number does change. So the correct answer is B, because here is a common misunderstanding. Do not confuse variable interval with variable ratio, because variable interval is about time, variable ratio is about the individual acts. And also the other parts of the question asks which group persists longer. And you need to know this for the MCAT. Variable ratio is the best method to train a behavior to persist longer. That's why slot machines in casinos give rewards at variable frequencies. So this is the correct answer. And also, don't be confused by the word average of 3 buttons, because the question is saying that the pigeons receive food after the average of 3 buttons, and you might say, okay, so it's after 3 presses. But that's not correct, because it says average of 3 presses. Sometimes it's 2 presses, sometimes it's 5 presses. It's just an average. Next question. A hospital screens blood samples for a rare pathogen using a test that requires a technician to visually detect a faint fluorescence under a microscope. Initially, the technician is told that missing a true positive, failing to detect an actual pathogen, could result in severe patient harm, while a false alarm, detecting the pathogen when it's absent, is merely inconvenient. After 200 samples, the technician is told that false alarms will now result in expensive follow-up testing and possible job penalties, while misses will rarely cause harm. Across both scenarios, the actual sensitivity of the test remains the same. Question: which of the following best describes a change in the technician's decision-making in signal theory terms? So, we need to define some terms here. First of all, liberal criterion. What does liberal criterion mean? Liberal criterion means you're more likely to say something is present. So you're more likely to have positives, right? Which means you're more likely to have true positives, which are good, you want them, but you're also more likely to have false positives, which you want to avoid, just like a liberal person. A conservative criterion is when you're more likely to have negatives, which means you're more likely to say something is not there, which means you're more likely to have false negatives and true negatives. So at first, the technician was told that having false positives, meaning saying the pathogen is there while it's not there, is not important because it's just gonna lead to some inconvenience. That motivates the technician to have positives, both false positives and true positives, which means the technician will probably follow a liberal criterion. But then they are told that everything has changed. Now, if you have false positives, it's a huge deal. You will face penalties and patients will face a lot of expenses. But if it's the opposite, which means you have false negatives, you say the pathogen is not there, while it's there, it's not important. So it motivates the technician to be more conservative and say things are negative while they're not. So that leads to conservative criterion, which is A, the correct answer. So next, researchers designed a study to examine how distraction at different time points affects memory. Participants briefly see a list of 15 random letters on a computer screen for half a second. They are randomly assigned to one of three conditions. Condition 1, immediately after three letters disappear, participants are asked to count backward by threes for 20 seconds before recalling the letters. Condition B, immediately after the letters disappear, participants recall the letters without any delay. Condition C, participants are given unlimited time to rehearse the letters aloud before being asked to recall them 1 hour later. Results show condition B, participants recall 9 to 12 letters in correct order. Condition A, participants recall only 2 to 3 letters. Condition C, participants recall 12 to 15 letters accurately. Which of the following memory systems is being tested in conditions A, B, and C respectively? So starting with C, the participants are given unlimited time to rehearse the letters, which means they can encode those information into their long-term memory. That's C. B, condition B, the participants are asked to immediately recall the letters without any delay. So basically that's your sensory memory. You didn't have any time to encode anything. That's your sensory memory. But for A, it's somewhere between long-term memory and sensory memory because you did not have enough time to encode it into your long-term memory, and also there was a gap, so we can say sensory memory. So we are going to go with A, working memory, sensory memory, and long-term memory, which is the correct answer. Thank you very much for watching this video. Don't forget to like and subscribe so you can see more of my videos.